Thank you so much, Susan. This was great. And we do have a lot of programs, so I think you shared with them, because I think the more information people get and the more education, it's better for everybody. What I'm going to do today is I'm going to be talking about a topic which is called Coping with Behavior Issues and Rethinking Your Approach. So I probably won't be covering everything, but if you do have any questions, please, we'll keep them, as Susan was saying, till the end. Forgive me, though, I will not be staying right after, because I do have a support group, so I'm going to be kind of rushing off after the support group. So that's where I'm going to begin. First of all, most people with cognitive impairments will develop some behavioral issues. Talking about maybe there's different statistics, maybe 60 to 80%. Some people would say everybody who has really, in terms of cognitive impairment, at some point will develop issues. Is that okay? Okay. All right, thank you, Elko. And many times some of these behavioral issues will become later on as the disease progresses. People have more in terms of behavioral issues going on. Behavior issues can be challenging to an individual, family, friends, and care providers. I bet everybody in this room would agree that this is something, and I don't even think it's challenging. I think it's extremely difficult. It's probably the most difficult thing that you're going to have to be doing, is dealing with some of the behavior issues, which in turn means that a lot of times people will be placed because care partners are really no longer able to really care for a loved one due to some of these behavior issues. The good news is that social and behavioral and environmental methods can really be helpful in dealing with these behaviors. And these are what we're going to be learning about today. It really is, I think, something that you know that you can do something to change some of the behavior. However, at times, I think it's really important to have some pharmacological interventions. This is like some of the drugs that can also be useful, especially when behaviors present a danger to self or a danger to others. So I'm talking about some of the antidepressants, I'm talking about some of the mood stabilizers, and I'm talking about some of the antipsychotics. So, what are some common behavior challenges? Delusions and hallucinations. A lot of times people kind of can confuse these. Two different terms, and they are separate. They do not have to go together, although frequently they do. What are delusions? Delusions are fixed beliefs. A person is really convinced this is a true belief. So they really do believe that somebody is stealing from them, that maybe someone isn't who they claim to be, okay? These are the things that are really irrational kinds of beliefs, whereas hallucinations are types of kind of experiences that really nobody else is seeing. So people are hearing things, they're hearing voices, people saying different things, they're seeing things, seeing people that nobody else is seeing. Maybe what you're doing is feeling something, tactile kinds of hallucinations, feeling some bugs crawling on your body. So again, that's the difference between delusions and hallucinations. What about agitation and aggression? Agitation would be resistive. Somebody doesn't want to do something and they're going to be really very, very resistive. This is something that's very, very common that we come across. And then you have aggression. Aggression can be really divided up into, I see it in two different ways. Number one, verbal aggression, which would be some of the yelling and the shouting and the screaming and swearing for people which really wasn't part of their personality before. Physical aggression would be the biting, the hitting, the kicking, the throwing. So that's kind of something that, again, is very, very common. What about depression? Okay. Depression, when I think of the term, I think of sadness, I think of hopelessness, helplessness, maybe somebody really in terms of doesn't feel worthwhile. But it also can kind of look at other different things. So sometimes people will have depression and then they have eating issues where they're eating too much, eating too little, they're having sleep difficulties. They might not want to do anything, so you have like an apathy. So there's a whole assortment of things that would fall under depression. What about anxiety? Anxiety would be fears. And I will tell you, probably one of the most common fears that you see with people who have any type of memory type problems and the dementia would be fear of being separated from a caregiver. If the caregiver isn't there, okay, it's pretty scary. Apathy. As Susan was saying last week, Dr. Wynn talked about the difference that apathy and depression really are two different things, okay? And you can be apathetic and not depressed. Apathy means a lack of initiative. It also would mean that you really don't want to do anything. But with apathy versus depression, you can be content. So somebody might not want to do anything, okay? They might lack the initiative, but they're content. They don't have any of the sleep problems. They don't have any of the eating issues that might really fall into when somebody is depressed and apathetic. Disinhibition. Disinhibition is when people basically act impulsively. So people might be talking to total strangers as if they do know them, taking liberties of touching someone, hugging someone, which is really out of character for them. So that's when I think of disinhibition. What about disorientation? This is disorientation to time and place. So if I asked everybody here in this room, what is the date? Hopefully people would say November 12th, right? I sometimes wonder, 2014. Somebody with dementia might say that this is May 1st, okay? And they might even say 1995. That would be a sign of disorientation. Another sign of disorientation would be if I asked everybody about what time it is. And people would say maybe around noon. If you are being disoriented, if you tell me that it's like 4 o'clock in the morning, that would certainly be a sign of disorientation. What are some other common behavior challenges? Repetitive questions. Has anybody experienced that with a loved one? Okay? Never, right? Never. That never ever happens. That somebody repeating the same question maybe 10 times in the hour, maybe even 20 times in the hour. And it can become somewhat frustrating or not? Okay. All right. What about wandering? Wandering is a really big issue, and that's why in terms with the Alzheimer's Association, they really recommend people having this medical alert safe return, where it's either like a necklace or a bracelet that really does go in terms of identifies a person and has a national database. But with wandering, it can be dangerous, okay, and someone really could, well get hurt. One of the things, and I know that I'm getting off a little bit, but one of the things that I've learned with wandering, and I'm just going to kind of throw it out, is that I read that if a loved one is wandering away, some of the things that you might want to do is try to look for someone about a mile from home. You might want to look near the road, because a lot of times people will go near the road. Many times people will go in their dominant with their dominant hand, the direction of their dominant hand. They will go to maybe some familiar places, okay? So if anybody, it really does experience a loved one wandering, not that we want that, and we're going to be hopefully trying to figure out so somebody will not wander, but if they do, there's certainly ways that people have really looked into it. What about pacing? Okay, pacing, where you're just kind of walking around, it seems like ram, without any purpose in mind. Again, very, very common. Bathing issues, okay? Bathing issues where a loved one does not want to really in terms of bathe, and they say, oh yes, I bathe, where you know they have not bathed for a week, okay? Again, this is a very, very challenging. Sleep problems, where people are maybe excessively napping during the day, and then maybe they get up in the middle of the night thinking it's morning, get dressed, and time to go out. Eating problems. Either somebody is eating too much, they're eating too little, they're only eating sweets. Maybe they have to eat in a certain order all the time. Again, a very common behavior challenge. And what about this last one? wanting to go home. Okay? And I think when you think about wanting to go home, this could be something where you have lived in the same house with this loved one, and they say, I want to go home. And what do you do? And so what you need to wonder is, what are they really talking about if they've lived in that home for 5 years, 10 years, 15 years? Maybe home isn't really just a physical place, but maybe it's a place where a person is feeling safe and loved. And maybe at that time, they're not really feeling safe and loved. So think about it in terms of the terminology. When we think wanting to go home, it really might not be a real place. So, what are some causes of these behavior challenges? Okay? This is important. A behavior issue may occur for different reasons. And what do I mean by that? We look back here in terms of one of the things with wandering. Okay? And so you wonder, well, why is someone wandering? Okay? Wandering could be because somebody is stressed out. But wandering could be because somebody is bored. Wandering could be because someone is looking for something. Maybe they're looking to find a bathroom. Wandering could be because maybe somebody is hungry. Okay? So there is so many different reasons why a person may wander, which is going to kind of reflect later on that I'm not ever going to kind of just give you like a topic of, okay, this is bathing and this is like what you do. Okay? What I'm going to want to do later on is give you a whole assortment of different kinds of techniques to put in your toolbox, so depending on why someone is doing something, you will maybe have a way of really kind of responding to that. Behavior issues can be adaptive. Okay? Why would something be adaptive? Well, it might not necessarily be the most appropriate, but maybe this is showing your feelings. Maybe this is how somebody is really trying to tell you something, telling you that they're hungry, telling you that they're upset, telling you that they're in pain. Okay, again, it's adaptive for them. Maybe not adaptive per se for you, but certainly for someone. How I like to look at it is behavior issues may be due to some physical, emotional, environmental, and task-related causes. And the reason I do this, it really does help me put things in perspective. So when I'm trying to figure out why, I've tried to divide it into categories so maybe I can look at what would be the causes. So let's look at that in more detail. What would be some physical causes of behavior issues? One would be medical conditions. And the first thing that comes to mind to me is a UTI, okay, a urinary tract infection, because I have learned, okay, and I have learned a lot in terms of from my support group, that a lot of times when their loved ones have a UTI, there's a lot of confusion. There is also in terms of a lot of people really becoming very delusional and becoming psychotic, okay. And the UTI isn't necessarily going to be showing up right away in a standard test. So again, medical conditions, okay? Other things that would be is if somebody has diabetes and their sugar level wasn't uncontrolled and they start becoming really agitated and aggressive. Or if somebody has a sinus infection. Again, if somebody has a medical condition, it can cause a lot of different symptoms, which in turn is going to affect somebody's behavior. What about changes in the brain? Okay, we're dealing with neurodegenerative diseases, so there are changes in the brain. There's loss of brain cells. There's loss of a connection between the brain cells. This is really going to be causing a change in somebody's behavior. Medications. If you look at any medications, there's always side effects, right? Okay, well, there's a good reason, because medications really can cause and really affect a person. And even if a person has been on the same medication for years, it doesn't mean that it's really affecting them the same way. And especially if other medications have been really, they're taking other medications as well. So if you have the interaction between medications, which can certainly make a difference. The time of day of the medications. So again, all of this can be used in terms of really causing changes in behavior. Dehydration. I bring this up because we're living in Nevada. Nevada's a desert. I know everybody's supposed to be drinking, and they really kind of say keep drinking water and water and water. But a lot of seniors and a lot of people do not drink enough water. And what happens when you don't and you become dehydrated? A lot of times you will become confused. Okay? You can also have become irritating. You can become, what else, when you're dehydrated? Okay? You're just not feeling yourself. So that is something to really look at. Constipation. Why would someone in terms of think of that this could really cause any problems? Well, it certainly does, because if somebody is in pain and somebody is uncomfortable, they might act out. And they might not necessarily be able to verbally express that they're constipated, but it doesn't mean that that's not giving some impact. Physical discomfort and pain. When I think about physical discomfort, I think of things like maybe clothes are too tight. Okay? Maybe someone is feeling too hot. Maybe somebody is feeling too cold, as well as somebody being in chronic pain. And a lot of times people are not going to say anything, but it doesn't mean this isn't happening. Fatigue and sleep problems. Okay, I bet everybody in this room honestly can say that when you do not get enough sleep, okay, you become a little bit irritable. You become a little bit short with people. Things aren't really necessarily as clear. Okay, you can't focus as well. So again, think about this. And one of the issues that we do see with people who do really have some cognitive difficulties and who do have dementia, they do have sleep problems because their sleep cycle is off. And visual and hearing impairments. If somebody cannot hear well, if somebody in terms of cannot see well, they're not going to really be able to respond as you might want them to respond because they can't hear or see you. What are some emotional causes of behavior issues? First of all, depression. Okay? Think about all the losses that someone has when really they've been diagnosed. Okay? A lot of times you'll have a loss of independence. You might not be able to drive anymore, so you're going to have a loss of all your driving privileges. Okay? You might think, well, look at my future. I plan to do so many things, and now I might not be able to do that because of with this diagnosis. So again, that could certainly lead to feeling depressed. Fears and anxieties. Trying to figure out what was really happening. Fearing that maybe somebody has some mental and physical disabilities. Maybe fear that you're going to be a burden to loved ones. As well as fear that people are going to reject you. Okay? They think maybe you're contagious and that they're going to get Alzheimer's disease too. What about the frustration? Frustration that you aren't able to do certain things that you could do before. You just don't understand. Okay? And it is very, very frustrating. And then the last one has to do with confusion. You just really don't understand what's going on. It just doesn't make sense. What are some environmental causes of behavioral issues? Okay, one of them is noise, okay? So if there's too much noise going on, okay, that certainly could really kind of create problems when somebody is having a little bit difficulty understanding and there's different things in the background. Overstimulation. When I look at it here, if somebody really does have some memory issues, there's a lot going on here. There's a lot of people going on here. Everybody's kind of doing things. Some people are watching me. Some people are writing. Some people are maybe just kind of being bored. There's lights going on. So there's a lot of different kinds of things. And if somebody is really having trouble focusing, overstimulation can really create a problem. An unfamiliar situation. As much as we think people like the novelty, I will tell you that one of the things, if you don't learn anything else for today, is realize that somebody who has a neurodegenerative disease, what you want to do is try to keep them into familiar situations as much as possible, because that is something that's very, very important. Lack of activity, boredom. What is somebody supposed to do during the day? A lot of times they can't do what you could do before, and so what you do is you really are bored, and boredom really does bring some behavioral problems. What about an unstructured environment? It goes along with really in terms of, I think, with the unfamiliarity, they're very connected. People like structure. I like structure now, okay? I like where things are. I will really be able to really know what's kind of going on. So structure can be very, very important. A lack of routine or a change in routine. Again, if anything kind of comes out, just remember, somebody who really has a neurodegenerative disease, in terms of behaviorally, what will be really helpful is you keep a familiar situation, a structured environment, and routine. What are some task-related causes? The task is too complicated. Somebody really, in terms of they're just not understanding, they can't put it together. You can kind of tell someone 2 million times, but if they're still too complicated, it's going to be too complicated. If the task has too many steps, how many times have you been told, try to keep the steps down? So if you're going to tell someone something, tell them one thing or two things. Do not tell them, 5 different things at once. A task is physically difficult. Where we looked at the task being too complicated from a cognitive standpoint, look if something is too physically difficult. If people are having fine motor difficulties or gross motor difficulties. Again, they're not able to do the task because it's physically difficult and it's unfamiliar. So we're back to making sure things are as familiar as possible with people. And this is something that is, I think, really important, is with the task related. A person is literally unaware of the decline, of, or they're really unaware of their having any difficulties. This is not denial. It is really, they're totally unaware. And there is a word for it, which I always pronounce wrong, but I'm still going to pronounce it wrong, but I'm still going to give it to you. And it's called anosognosia. And it's spelled A-N-O-S-O-G-N-O-S-I-A. And it means without awareness. So it's without awareness of the disease. So we looked at what are some of the behaviors. We've looked at some of the possible causes. So the next step is to do, what do you do about them? Right? That makes perfect sense to me. So the first thing what you want to do is, it's called change the antecedents. And in English that means what causes the behavior. Now those triggers can be people, they can be things, they can be feelings. They can be change, and let's say if you use another caregiver, they can be change if somebody is going on a trip. Anything can be seen as a trigger, which is something that you're going to have to be aware of. The other thing, when you're looking at types of behavior management options, is changing the consequences. What happens as a result of the behavior? And you know who falls within that? Everybody in this room. How are you reacting? Are you really treating something, a person, being patient with them? Are you giving them the respect? Are you putting any undue pressure on them? What are you doing that's really making an effect? And indeed, by changing your reaction, which is like changing the consequences, you really can change their behavior. Do you guys believe me or not? Okay? All right. Well, good. Somebody's believing me. All right. So first of all, general considerations in behavior management. First of all, you got to assess the situation. And the first thing you have to do is decide, should you intervene or not? Okay? Is the behavior at risk to someone's health and safety? And if it is, you do intervene. But if it isn't, then maybe you don't even have to do anything. So a perfect example, if somebody is pacing around the house, okay? Irritating, yes. Okay, is a person in danger? You've put like safety locks all over. You've taken away all those kind of rugs, you know, those throw rugs, so they can't fall. Things have been kind of locked up, so they can't really get at anything, and they're just pacing around. Okay? So, is someone in danger? I don't think so. So maybe in that situation, maybe you're not going to do anything. However, let's say in the middle of the night, someone gets up and they go outside and they don't really have any clothes on and it's in the middle of the night and they're screaming. Is that time to make some kind of intervention? Yeah, okay. Okay. So that's the first question. The other thing is, will an intervention that you decided to use and you've picked, will it make a person feel comfortable? Will it make a person feel respected and cared for? So think about it when you're trying to do anything. You want to really give that person respect. You really want to care for that person and make them sure they realize it and that they're comfortable. And the third thing to do is think, is it worth all the time and the energy and even the possibility that you're going to make something worse? So that's the first thing you have to decide, is you're assessing the situation. Should I really intervene or not? Once you've made that decision, say, I've gotten all, okay, I am going to do some intervention, I have to. So then what you have to do is then you really need to now look more closely at the whole situation. Figuring out when it occurred, who was there when it occurred, what was happening. You can look at the time, you can look at the place, and then looking at what followed afterwards. And could I, meaning everybody in this room, could I have done anything differently to stop it? So that's looking at the whole situation. You do want to rule out medical conditions because you can have some of the very best interventions, but if somebody has a medical condition, what are you supposed to do? You need to treat that medical condition. You need to go to a doctor and find out what's wrong and really make sure that that medical condition is being under control. You also need to look at the medications. Again, talking to the doctor to see if that's really affecting it, and then that's where you first have to go to, is saying, well, maybe I need to change medications, maybe I need to take medications at a different time, maybe I need to take medications with food, whatever it is. Identify any sensory impairment, talking about if somebody cannot hear you, then you have to figure it out how to do. If somebody can't see very well, again, looking at this as a first consideration. And then, this is really important. Be prepared to make adjustments. And I'm going to say that again. Be prepared to make adjustments. Because you can have the best interventions and it might not work. So then what do? You need to make adjustments. So, what are some possible environmental methods for managing behavior? And a lot of times when we're going to look at the environmental methods, I'm going to kind of go back and I'm going to tell you that we're going to look at some of the triggers. These antecedents, changing at what causes the behavior. We're going to try to rearrange this environment, so that's going to be better. Okay? So the first thing is to plan ahead. So when I say plan ahead, if you know a loved one gets more upset in a large crowd like this, okay? And let's say you decide that you want to go out to lunch, okay? Maybe the best time not to go out to lunch is exactly 12 noon in a crowded restaurant, a very popular restaurant where people are rushing around. Maybe a better intervention in terms of planning ahead is maybe to select a restaurant that might not be as crowded, or go at 11 o'clock instead of 12 o'clock where you have that whole rush hour. Again, planning ahead. I don't know about you, but I get really irritated waiting at a doctor's office for like an hour or two, you know? Think about a loved one who has dementia. So maybe what you need to do is when you make a doctor's appointment, call up and say, when is his first appointment? either in the morning, okay, if that's the best time for a loved one, or right after lunch, if that works for a loved one. So really kind of figure out where somebody really is at and really try to plan ahead and try to really schedule things so you really are kind of taking some of those triggers away. Promote a safe environment. That's talking about in your household in terms of promoting it. So you want to try to change the environment to minimize any problems. So at least for me, if somebody has guns in their household, I would be very reluctant to have a loved one have access to those guns. So I would try to get them out of the house, okay? Or at least make sure that they are very well locked up. Also, in terms of some of the detergents that you have or some of the chemicals that you're using, dishwashing detergent, okay? If someone really is having maybe some cognitive difficulties, think about them that they might think this bottle is something to drink, okay? Could really lead to a lot of issues. So really maybe try to lock some of those things up. Have locks on the door so someone might not be able to wander. Again, try to promote a very, very safe environment for you and your loved one. Decrease noise and distraction. If somebody is having a real difficult time trying to focus, okay, it makes perfect sense to try to give them into an environment where there isn't a lot else going on. So there isn't noise going on. There isn't the TV set in the background. If you really want to tell someone something and really want to really communicate, get rid of some of that distraction at the time. It would also be, when I think about it, if you're trying to be with someone and you get a telephone call, but you're still talking on the telephone call, a loved one is here wanting to ask you a question, and so you really are being distracted in both ways. So think about some of the things that you do. Minimize stress and novelty. We've covered this many times before, I've said it, but I think it's worth saying again. People like things that are very familiar to them. Familiarity really does reduce stress. Slow down and simplify. It's hard to do. Am I talking fast or am I talking okay for everybody? Okay. But if I talked really fast like this and tried to get my point across, okay, you know, then it starts everybody, don't you understand what I'm trying to say? But if I slow down, not too slow, but slow down so someone has time to process, this can really be very, very helpful. And simplify. I try not to use some really big words. I probably don't know big words, but even if I did, I would try to I want to simplify things so people can understand. The issue isn't that you want to be so bright. What you want to do is get your message across. And however that means, that's important. Establish routines. Routines, okay? We like the consistency. We like in terms of really something's familiar, and also routines. Provide activity. If somebody is bored, and a lot of times people will be bored because there's less that they can do, try to get some things that you think that they can do. So if somebody is pacing around, okay, they're looking for something. Everybody wants to be productive. Maybe what you can do is kind of have some of your laundry, have them fold towels, okay? So what if they don't fold them perfectly? It's an activity for somebody to do. Or have them help you do, let's say, the cooking, okay? If they can't cook by themselves, so you're saying, oh, I don't trust them in the kitchen, that's fine. But maybe give them something to kind of hand to you. Will you hand me the sugar, and if they can't understand that, have it right there and hand me that. But again, what you want to do is have somebody doing something so they feel like a productive part of society. And exercise. I know everybody gets exercise. Everybody tells you to exercise. Doctors tell you to exercise. You read it on the internet to exercise. But exercise is something really good. It is an activity. It also helps with depression. There's some things that in terms of all the literature is saying for people's cognitive welfare, exercise is important. So again, try to incorporate exercise. It doesn't mean that you have to run a marathon. Has anybody ever run a marathon here? Oh, we have people who do that. Okay. But you don't have to do that, okay? You can still just be walking around, okay? And if you have trouble with, in terms of with arthritis, do some exercises in the pool. Okay, again, I know there's kind of like classes for that. So again, any type of exercise someone can do. What are some social methods for managing behavior? First, respond to feelings. A lot of times it's not what a person says, it's the feelings behind it. And a lot of times what you will find is people really, in terms of they have difficulty coming up with the words they say, or they might use the wrong words. Just always remember to try to think of what is those feelings behind and try to respond to the feelings. Maintaining calm within yourself. And I'm not saying this is easy, okay? But I will tell you, if you are calm, that's going to really, I think, be really seen and being addressed by your loved one. And they're going to calm down. And one of the best things to do when you're doing calm down is to do some of those breathing exercises, or there's mindfulness, things that you can do. Does everybody, I'm going to give you one of the easiest breathing exercises I do. You don't have to count, you don't have to do anything. But in a very situation, this really does help calm me down. Is you take a deep breath through your nose, and then you just take a sigh and you breathe out through your mouth going, okay? Take a deep breath through your nose, and then just let it out, okay? It's a calming effect, and a loved one is going to be picked up in that calming. I'll tell you also something that I always kind of think about when I'm thinking about calming, is I read this a long time ago, is when people are worrying, it's like a rocking chair. You keep busy, but you never get anywhere. Okay, think about that analogy, okay? So when you're also in terms of that's really stressful situation and you're worrying about things and you're not calm, think about it's like a rocking chair. You keep them busy, but it's not going anyplace. Be aware of your nonverbal behavior. This is really, really important, because if somebody really cannot respond to their words, they're really going to respond to a lot of your nonverbal. So I think it's really important to give people their full attention. That means eye contact, really in terms of having an open posture, leaning forward a little bit, listening to the tone of your voice. Okay, is it something that's pretty soothing and sweet, or is it like really good and mean? Okay, again, it's not the words, but looking at all this non-verbal kind of behavior and communication. Distraction. When somebody is necessarily, they're saying to you, I want to go home, I want to go home, and they start pacing, I want to go home, I want to go home. And what you can say, you are home, okay? That would be the one thing. It doesn't work because they don't believe you, okay? But maybe what you can say is, you know what? Okay, I understand, but you know what? Before we go, maybe can we go get a cup of coffee? You know, I'm okay, but I just really need something to drink before. You get them out of the room. That's a distraction. And a lot of times they'll forget that they wanted to go home. Ignoring something. As you know, we talked about initially in terms of when we're assessing the situation, is it really worth doing an intervention or not? And many times things, as much as they can be aggravating to you, maybe it's just worth ignoring. You gotta pick your battles. You really do gotta pick your battles. What about prompting and modeling? If somebody does not understand something, maybe they need a few prompts. Okay, that's why we have calendars. We have like alarm systems going there. And also in terms of modeling the behavior, what you want to do. Showing someone. So if someone might not necessarily understand, if you say, do you want a cup of coffee? Okay, and you take it for granted that they really understand. Maybe they don't know what that is. So maybe what you need to do is to prompt them by giving them a cup and also modeling it, drinking it yourself. That would be falling under prompting and modeling. And I think this is really important, is if all else fails, get help from others. Okay? There is going to be a wealth of information in this room, One person might know something, okay, and another person might know something, and another person might know something. So now it's not just you. And if something doesn't work, maybe in this whole group, one person might be able to have a different idea. So getting help from others is not a sign of failure on your part. It's really a very strength that we all have to start doing. What are strategies to avoid? First of all, arguing. Why doesn't arguing? It doesn't work. It doesn't work. You're not going to win. You're not going to win no matter what you do. Okay? And all it's going to do is escalate the situation. You're going to say, no, you know, I did not steal that. You misplaced it. And the person says, I did not misplace it. Basically, you took it from me. Okay? It's just going to escalate. How about reasoning? No, it doesn't work for sure. Because one of the first things that goes is logic. So, yeah, that's something. And again, it's kind of like learning a new language. You can't use logic. How about patronizing? Nobody likes to be ordered. Do you like to be ordered and told to do something? So a loved one isn't going to want to do that either. Demanding that someone stop. It would be, stop doing that. Okay? You're going to burn yourself. Okay? It's not going to work. It's just not going to work. Blaming something, as we talked, okay? You know, telling them you lost something, you forgot something, you misplaced something, okay? Blaming is something like putting someone in a corner. And what do you do when you're in a corner? You come out fighting. And telling a person he's crazy. Now, you would say nobody does that. Nobody in this room has done that. And maybe nobody hasn't done that. But I will tell you, I've done a lot of testing with people who have memory disorders. And one of the first things they say to me is, you know, I'm crazy. I'm crazy. Where are they picking it up from? Okay? I don't know, but if it's not from, it's something that they really do feel that people think that they're crazy. What are some other strategies to avoid? Number one, talk loudly to increase understanding. If somebody does not have a hearing issue, talking loudly isn't going to do anything. It's just going to make somebody really, in terms of more irritated because, you know, you're talking loudly. Showing you are afraid. Just as we said, people pick up the calmness in you, they're also going to pick up the fear. And if you see somebody who's looking at you and they think that you're afraid, they might not understand why you're afraid, but they're going to start picking up on that emotion, and then they're going to be afraid. Don't know why, but they're going to be afraid because you're afraid. Personalizing the individual's behavior. Sometimes a loved one might do something that would be somewhat inappropriate. So, for example, they would be in this room and all of a sudden in a very loud voice they'd say, look at that fat lady in the back. I can't believe she's so fat. Okay? It doesn't matter what she's like, okay? That's really embarrassing. Now, you would think it's their fault. But a lot of times you're saying, oh my gosh, you know, people might think that, look, what am I doing? I must not be a good care person, or I haven't taught them that well, or they're not doing it. You start personalizing everything. Or if a loved one comes here and they have a purple shirt on and striped, I don't know, it probably is good in fashion, maybe green, yellow, orange, something, okay? And you say, uh-oh, people are thinking that I really don't care about my loved one. I haven't dressed them appropriately. Again, that would fall under you personalizing. Try to avoid that. Asking questions that rely on memory. Okay? I know you want to make sure that everybody realizes that your loved one maybe hasn't had a decline as much as you think. But think about it. If they cannot remember one time, let's say the name of their children, okay, and you have someone and you've asked them, and they can't do that, even if that feeling lasts for 1 second, feel how devastating that would be. And trying to grab or corner. Okay, again, someone's going to fight right back at you. So that really isn't going to be helpful. In conclusion, I think there's a couple of things to be in mind. Be flexible. One kinds of intervention might not work, so you have to be very, very flexible. and think of what else will work. You want to be creative. Think outside the box. One of the first, I think, examples of this would be, and I learned this probably about 15, 20 years, is somebody was having, well, I guess in terms of they were having some delusions and hallucinations. They were thinking that they were seeing them in the mirror, that people were kind of coming out at them. And they were very, very afraid. And it was really their own reflection. Okay, so what did somebody do? They covered the mirrors. Okay, and then guess what? That behavior dissolved. So again, sometimes you got to think outside the box. Okay, you want to set realistic goals. A loved one might not behave as they did 15 years ago, 10 years ago, 5 years ago. So you really have to figure out what goals you have in mind. The effectiveness of strategy may vary day to day and from person to person. So you might try something one day and it'll work great. And then all of a sudden the next day, it doesn't work. One person might say, I got this, this is so perfect. This really helped, okay? My loved one, started really taking a bath all the time. I did this and that. You try it, it doesn't work. So again, the effectiveness of the strategy may vary day to day and from person to person. But I think this is important, that I still believe that social and environmental methods can really be helpful for managing behaviors, even for severely impaired. Okay, with that in mind, I'm done. Does anybody have a quick question? Because we have like a few minutes. I wanted to leave a few minutes before. Does anybody have any questions or comments? Nothing? Go ahead. Thank you.
I have a comment. It's kind of like when you have a young child, like 2 years old. It's kind of like you almost have to revert back to when you have children, as far as not giving them too many directions or redirecting their behavior. So it's kind of, thinking it's not wrong to treat them that way.
It's not wrong to look at that kind of behavior. What I will do, though, is one of the things that I like to think of is this is still a mature adult. It's not like a 2-year-old. So you might think about that, giving directions, very simple directions, and that's great what you said. But at the same time, I think you have to really respect the fact that this is an adult as well. And that's a hard distinction, but I think it's a very important distinction, that we don't want to revert and say, okay, I'm just going to treat them like my 2-year-old because they're a 2-year-old. We have to use some of the techniques that maybe you used at a 2-year-old, but your loved one is not a 2-year-old. So, but thank you, that was great. Yes?
I have a question. Sometimes I'm dealing with physical aggression, okay? And I guess my question is about showing whether or not I'm afraid in those kinds of situations. Occasionally I am. And so I'm trying to decide, do I just cower, run, or act like it's okay?
Well, I think you have to do a couple of things, okay? Because there's nothing, I think, in terms of, as I see black and white. Number one, if your safety is in danger, you need to get out of there,
right.
Okay? That's something that's really, really important. However, if in a sense you can, really kind of try to calm yourself down, I think that really can be helpful as well. So you have to make the distinction. If you feel that somebody, is really going to hurt you, okay, I wouldn't stay around. I would really try to get myself into a safe place. I would even call 911 because, that's something that really is important. But I think at the same time, thinking, is there anything that I am doing differently that I'm making and escalating the situation? Okay, but that's an excellent question. Anything else? Yes, ma'am.
What if you have a situation where a loved one's not recognizing his limitations and capabilities and is resisting assistance or help?
Okay, and that would be what we're talking about in terms of that term that I just kind of taught you, that anosognosia, okay, with the silent G, okay. And that's really difficult to deal with. And I think that for that part, what you have to do is you have to be very creative. And what I would do, depending on the situation, is can you give me an example? So that kind of would help. Of what give me an example where they say that they can do something that you can't. So maybe that'll help.
For example, my husband has not been able to pass the driving test, so he doesn't drive. But he won't, he doesn't want anybody else besides me to pick him up or take him places, not
Okay.
limited. Or oftentimes he will wander, and he's not to the point where he can't get back, but he will get lost. Or
Okay.
he will just wander aimlessly, and it's.
Well, I think with the driving issue, one of the things that I would do is I would try to put it on somebody else, put it on an authority, okay? So what I would do is it's not my decision that you can't drive, okay? But it is, in terms of the doctor kind of has said that, and so kind of get it off your back. And if that even makes being creative, where if he's insisting on driving the car, that you have to kind of do something to a car. I'm not a mechanic or anything like that. So I think that would be one issue. The wandering, I think, is where maybe you can have that someplace do you live in a house that has a backyard or anything? So maybe kind of have a certain section that he's not going to be wandering away. Because even as you're saying, well, he knows how to get back, there might be one instance where he really will not be able to get back. And that's the good thing is if he has a safe return, that some kind of identification, because a lot of times people will become very, very confused and they will can't remember any in terms of where they are, who they are. So I think that to have some kind of that identification, and maybe having a place where he can still kind of be around and have some movement, but he's not getting out, because it only takes one time, just one time.
Well, he won't wear anything that even identifies him as having any of these issues or challenges, so it's, difficult to.
Well, maybe I'm going to think outside the box. I don't know if this is good or not, but maybe what you can do is in some of the clothing, maybe kind of sew something in there. Because I won't do a piece of paper because people can take out the piece of paper, but maybe, in terms of have something sewing that if anybody he gets lost for whatever reason, that there's some identification.
Thank you very much, Dr. Knox.
All right.
Really appreciate your time.
All right, thank you very much, Elko. Thank you, Paran.